First at 6, doctors named St. David's Healthcare as a conspirator in a lawsuit filed in federal court. The physicians say contractors with the hospital pressured them to make medical decisions to save the hospital money. That is against the law. KXAN's Phil Prazen is here in studio. And Phil, you spoke to the doctors.
Well, yes, Aaron. The group Hospital Internists of Texas filed this lawsuit in federal court. They represent about 80 doctors, and they're the ones who go around and do general care in the hospital. They were also the ones who terminated their deal with St. David's contractor, Team Health, because they say they were tired of medical decisions being made by people who weren't doctors. Dr. Dieter Martin is a partner at the Hospital Internists of Texas.
Decisions start getting made outside of the room that you and the doctor are in. And that can lead to a lot of mischief.
Specifically, the lawsuit claims Team Health staff would tell the doctors to discharge patients before they were medically ready to leave. Another claim is if that staff thought a doctor was costing St. David's too much, they would replace the internist with a temporary doctor. And now, since the contract is terminated, they're all replaced. Martin says that high turnover increases wait times and decreases care.
Unfortunately, even with the best of doctors, when you hand off patients, it's a little more dangerous for the patient because the doctor handing off knows so much more about that patient.
St. David's rejects the idea that care has been compromised. Denise Bradley, VP of Communications, says they've now recruited experienced hospitalist physicians to replace HIT, and the transition has been seamless to patients. She says the internists who filed suit have not been removed from medical staff and can still see patients if they want. She goes on to say the claims in the lawsuit are false and are disappointed in the way HIT is handling this. Team Health, the contractor, chose not to comment either, per company policy. And for perspective, lawsuits fly around the medical industry all the time. But if this one drags on, Dr. Martin says those with Hospital Internists of Texas will have to decide whether to move out of Austin or go across the street and try and get a job at another area hospital. It's unlikely they'd continue to work at St. David's without a contract. Aaron?
Thank you, Phil. And we wanted to know what rights patients have if their wait times or access to resources are affected. Here's what we found in St. David's Patient Bill of Rights. The website says you've got the right to report and seek answers to any problems you have with your health care. They say that includes wait times, lack of services, how you're treated, or billing. The website adds you should be able to find help through your health plan or the hospitals if needed. The HIT says if you would like a specific local doctor, you can ask your nurse.